For my final project, I will be doing the disease diphtheria. What is diphtheria? Diphtheria is a serious bacterial infection that infects the mucous membranes of your nose and throat. It can also be identified as a pseudo membrane that blocks the airways. This disease is then spread from person to person through close contact with the discharge from an infected person's nose, eyes, throat, or skin. Diphtheria is a life-threatening but vaccine-preventable disease. This disease is found to be extremely rare in the United States and other developed countries. Symptoms of diphtheria are usually beginning 2 to 5 days after a person becomes infected. So some of the signs to look for are the thick membrane covering the throat and tonsils, also discoloration in the back of the throat that can look gray or black, swelling glands, difficulty breathing, nasal discharge, fever and chills, feeling of unknown discomfort or illness, something that is just not normal to you. Go get that checked out. It also depends on the person how symptoms react. There was a case of an 11-year-old girl who came to the hospital with abdominal pain, joint pain, bloody stools, and pink eye, and she was diagnosed with diphtheria. Someone else had no symptoms. They were very mild, felt fine, and just carried about their day with the disease still inside of them, showing no symptoms. How has this disease been understood? The diphtheria epidemic is still to this day poorly understood. The disease continues to cause difficult obstacles that are affecting developed and developing countries. Some reasons include to poor immunization coverage, adult vaccines not being accessible, weak case-based information to support the vaccine coverage and the vaccine itself, and the persistent multiple foci that infects the organs. And what is foci? They are cells that are located in a specific organ of the body that is very distinguishable from the other cells that are surrounding the organ, so you will know exactly what it is when you look at it. And is there a heightened risk of diphtheria resurfacing as an epidemic again? And the answer is yes, due to investigations of recent outbreaks that are trying to understand the epidemiology of this disease. What if people thought caused the disease? Diphtheria is caused by Corynebacterium, and what does this Corynebacterium do? It is a bacteria that can be gray or an almost black, thick membrane that coats the back of the throat, making it very difficult and hard to breathe. Corynebacterium is also known as the Klebsiella bacillus, and it is known this due to the German bacteriologist who discovered this disease in 1884. How did they come to that conclusion? The recognition led to the development of both an effective antitoxin-based therapy for acute infection and then the highly successful toxoid vaccine. Some samples were collected and transported in sterile test tubes by qualified techniques and microbiologists from the government medical teaching hospital laboratory. There were 10 lab cases that were confirmed. The results were positive for the Corynebacterium diphtheria in 9 smears and 2 cultures. How has that changed or not changed over time? Some people have had different opinions as to what caused the diphtheria epidemic. Some ministers blamed our early American diphtheria epidemics on God's anger at colonists straying their religious beliefs. One historian has even claimed that diphtheria was the root of the religion's Great Awakening of the 1740. Technology has obviously changed over time, so the accuracy of the diagnosis of diphtheria is usually a very interchangeable diagnosis. Again, it depends on the person. We've changed our methods a little bit, traditional versus the LSPR. The traditional method for diphtheria, the detection was time consuming and low sensitivity, and now with LSPR, or otherwise known as a localized surface plasmid renaissance, is based on specific immunological interactions between the nanoparticles, and this is for rapid detection of the diphtheria and is not as sensitive like the traditional. The one thing to note that is not changed is a known fact that diphtheria is caused by the toxigenic strains of the Corynebacterium in diphtheria. Has there been any change to that the disease has been defined? There has not been any significant change in diphtheria. Again, as stated, other than being able to use more modern technology to keep researching for any signs of any changes in the bacterium. Again, many people thought this disease should be identified as God's wrath. Other people thought this was caused by karma, while some believe it was because of an underlying respiratory issues. We then found out that antitoxin is produced in horses that cured the disease. Horses are no longer being used today, but something to think about. Have different symptoms been attributed to this disease? The symptoms range from each patient, but the most typical symptoms are listed below: chills, fever, sore throat, cough, fatigue, the thick gray black membrane covering the throat, nasal discharge. How has the disease been treated by the medical community? Many scientists knew that the only cure for diphtheria was the antitoxin made from horses. Many scientists wanted to get the same cure, but not with the help from horses. So today, a group of scientists funded by an animal welfare has used lab grown cells to make human antibodies that they say could finally replace the ones produced in the horse serum that was used to cure. Also, diphtheria can be treated by medications that we have in modern time. What treatments have doctors prescribed, and has this changed in any way over time? Yes. As you can see from the pictures, in the late 1890s, the treatments for diphtheria was very skeptical, scary. People were testing things. They would give patients hard rubber, almost tubes, that were gold plated. They would remain in the patient's throat until he or she either became fine, well, coughed them back up, or died. Now people are taking medications, the vaccine, so the treatments that the doctors would prescribe are definitely changing. Has the disease been understood or viewed within society? Diphtheria was once viewed by society as a deadly disease that was very scary if you got it. But now, with modern technology medicine, diphtheria is found very rare in many developed countries, and it is especially rare because of the vaccine and medications that we have today. Has this changed over time? Comparing what diphtheria was like in the 19th century and how that was being treated, how it was looked at by society compared to now, there definitely were changes. Like I said in the last slide, it is very rare today. There are always going to be changes in technology, and of course the treatments, diagnosis, lab results, technology, and just better knowledge on medicine and the human body in general have definitely changed over time. And that concludes the end of my lecture. Thank you.